Hi, it's Mel from Ultimate OSCE and I'm here today to talk about the implementation station and in particular PRN medications, as this is a section of the MAR chart that some nurses are getting a bit confused with, especially when it comes to whether or not to code. Okay, so I'm just going to give a quick overview of PRN medications and hopefully you'll have a better understanding after this video. Okay, so PRN medications, or as required medications, are medications that are prescribed for us as a registered nurse to understand if it's appropriate and safe to give our patient. So the OSCE examiner is looking at our medicine management skills, which we've talked about in other videos. So medicine management is where we as nurses don't simply administer medications, but we understand what the medication is for, we can demonstrate this understanding to the examiner, and that we know when not to give a medication because it's not safe to give. For example, if the patient is allergic to the medication prescribed, it is good medicine management to know that we can't give that medication, to know that we have to get the chart changed by the prescriber. Okay, so PRN medications. We have got in our OSCE, and this is to illustrate this example better, it's always good to give an OSCE patient. So I'm going to show you the section of the chart. So it's the bottom section on page 2, and I hope you can all see it watching at home. So we've got John OSCE, he is our OSCE patient and he's in pain when it comes to the implementation station. He's got 5 out of 10 pain, and we open our drug chart and we look and we see that he is prescribed PRN paracetamol. So because he's in pain, it would be appropriate to give him an analgesic such as paracetamol. We check his allergy status, he's not allergic to it. But we look through the chart and we note on one of the pages, to make it easy, we've written it in the stats section of the chart, that he has already been given medication. So our implementation station scenario is taking place at 1400 hours, and we see that an hour before it, 1300 hours, he's had paracetamol. So we realise when we see this that he can't be given the paracetamol in the PRN section because it's not due yet. Okay, we're not withholding the medication. So if we go back here, to our PRN section, we now decide what to do with it. So are we going to code this medication? No, we're not, because this medication is not being withheld, it is just not due yet. So what I mean by that is we can give this medication later. This order is a good order, but we just can't give it now because because in order to give it we have to wait for 4 hours after the medication was given earlier. Okay, so we need a 4-hour window and we don't have that. So we're not going to code it. We're just going to verbalise to the examiner that we acknowledge our OSCE patient is in pain, but we can't give the medication prescribed, the analgesia prescribed, because it's not safe to do so. And we just leave it blank and we move on to the rest of the chart. If we don't find a medication, a pain relief on the rest of the chart that we can give the patient, because there are no due medications that the patient can have as analgesia, we will then simply verbalise to the examiner that we will speak to the doctor and we'll get another pain relief medication prescribed. Okay, I hope that's made it easier for you guys. If you've got any comments or any questions, if you're watching on YouTube, just write it in the comments box and I'll answer it for you, or you can ask on the WhatsApp group, or I'll also put this video up on the OSCE group Facebook page and I'll answer any questions there that you have. Okay, all right, thanks, bye.